Okay, I had to take a break. So with diabetes, we have hypoglycemia and hyperglycemia, right? So hypoglycemia, you're gonna need some candy. So I always like to think of the Paul Blart Mall Cop scene when he was, I think he was in the elevator or the closet, and he had collapsed and he was trying to reach for some candy or sugar because the sugar was too low. So they can present with shakiness, confusion, diaphoresis, also known as sweating, palpitations with tachycardia, blurred vision, seizures, coma, and they also present cool and clammy. So if a patient is unconscious, you want to make sure you place them in a lateral position to prevent aspiration and administer glucagon to the subcutaneous area or intramuscular area. And you want to repeat every 10 minutes if they're still unconscious. If so, make sure to contact or notify the provider. And for glucose, or you can give glucagon and dextrose 50% if the patient cannot swallow. Okay, what else? Let's see. And some expected findings with hypoglycemia would be high wash. So they can have headache, irritability, weakness. What else? They can be anxious. They are sweating and they have hunger. And then for conscious treatment, so while they're awake, you want to make sure you offer juices, snacks, carbs, specifically 15 grams, 15 to 20 grams. You want to offer glucose tablets. I want to say I think it's 3 to 4. And then for for some farm by mouth meds, you want to make sure that they have no iron, no calcium, and no antacids. So those are like our metformins and other stuff like glyzipides, whatever it's called. And then let's see, for patient teaching, you want to tell them to avoid intaking excessive amounts of insulin because that can cause the hypoglycemia. And then tell them don't exercise or don't drink alcohol on an empty stomach because it can cause the sugar to decrease. And then insulin peak times can also cause hypoglycemia. All right, so hyperglycemia. So anytime we think of hyperglycemia, just think of hot and dry. So their manifestations would be hot and dry. They have an acetone fruity breath. Start thinking of DKA. And then what to do, you want to encourage sugar-free fluids to prevent dehydration and test the urine for ketones. And then some expected findings will be the 3 Ps and the 4 S's. So the 3 Ps, so we have polyphagia, polyuria, and polydipsia. Those are the 3 Ps and those are the signs for hyperglycemia. The 4 S's for what can cause hyperglycemia is steroids like prednisone, skipping insulin, because if you skip insulin, you're gonna have too much sugar, which makes sense. You wanna make sure that they have a decreased stress because stress can also increase sugar, and sepsis as well can increase sugar. And another thing you can do is also, give insulin because they have a low amount of insulin and hyperglycemia. So some medications. So we have long-acting, which is DLG, also known as Detromir, Lantus, and Glargine. And you can only give it in the subcutaneous area. So I always like to think of the Macarena. So you can give it here, even in the back, in here too as well, but here, and I think here, or is it here, and then here, and then here and here, yeah, like that. So you get the gist, like where we can put the fatty areas. You want to make sure you give it once a day at the same time. And then for intermediate, which is their MPH, it can be left out of the fridge for 28 days. And you want to give it from 30 to 60 minutes before meals and at nighttime for sugar control. And then for short acting, which is the regular insulin, you can give it through subcutaneous and IV. And you want to make sure this is given 15 to 30 minutes to control postprandial hyperglycemia. And then we have rapid acting insulin. Sorry, I'm very tired. And I use the acronym LAG And it stands for Lispro, Aspart, and Glucosamine. And you want to make sure it's administered before meals, and because the onset is 20 to 30 minutes, so it's shooting up fast. And then let's see, did he get all of it? I think so. Okay. So for some client information, so we have insulin, right? So the one that we always know on how to give insulin, if we're giving like NPH and regular, so our short acting with intermediate, you always want to do Nancy, Regan, Regan, Nancy. NPH, regular, regular, NPH. So what you're going to do is you're going to eject the administered air. You're going to inject air of the administered amount into the NPH, and then you're going to inject the air of the administered amount of regular, like of air, into regular, and then you're going to draw up that administered amount of regular, and then draw up the short acting. And then you can give the NPH. I'm so sorry, y'all. I'm just tired. Want to make sure they rotate the injection sites. Like I said, the Macarena, because that can cause lipoatrophy or lipohypertrophy or lipoatrophy. And you want to make sure you're going at a 90-degree angle when there's a lot of subcutaneous fat there, and a 45-degree angle on thin skin. And when mixing short and long insulins, you always want to drop the short acting first. And let's see what else. Inhaled insulin is contraindicated with COPD and other lung issues because it can cause bronchospasms. You always want to tell the patient to wear a medical wristband. And that's it for insulin. For foot care, you want to make sure that they trim straight across, they don't round the edges because that can cause cuts. And typically people with diabetes have diabetic neuropathy. So you want to make sure they trim straight across, or they can file with an emery board, still making sure it's straight. You want to make sure they check the feet daily. Apply lotion, but not between the toes, because that can increase infection or fungus. And then you want to make sure they use their wrist to check the temperature when they're putting their feet or soaking their feet in water. All right, let's see. For metformin, this is the oral anti-diabetic med. So this, you want to make sure they take it with food, and they take vitamin B12 and folic acid supplements. And you want to notify the provider if lactic acidosis occurs, which is like somnolence, which is like a lot of sleeping, hyperventilation, and myalgia. And then for people that have diabetes and they're sick, you want to check the blood glucose levels every 2 to 4 hours and have them rest, and check the urine for ketones, because it could be a possibility that if they do have an infection, it can lead to DKA. And then for exercise, make sure they wear closed-toe shoes, and then have sugar cards before they work out 1 hour before. And then for diabetic retinopathy, in the imaging or where how they look at it, it'll look like they have cotton wool spots. And then you want to make sure to tell them to perform yearly eye exams, and that hypoglycemia causes blurred vision, or temporarily blurred vision. And for diabetic neuropathy, you want to tell the patient to make sure they report any tingling, joint problems, or numbness, because they can have peripheral neuropathy or neuropathy all over like the body systems. Okay, so this is diabetes right now, but what I'm going to do is kind of go over and rewrite some things out for the lab test. So take a screenshot, take a photo, whatever you may need, because I'm just gonna erase all of this. Dang. Let me start rewriting some stuff as well. All right, so diabetes, mellitus, right? And we have laboratory tests that we usually give to patients to test if they have, diabetes or what their levels are at. So let's put a little star. Laboratory test. Okay. Let's see what the ATI book says. All right, so first things we have. So we have our diagnostic criteria. So it says manifestations of diabetes plus casual blood glucose concentration greater than 200 without regards to time since last meal. I'm not going to write that down, but we know, let's just write down what we do know. So let's see. I will write this down. The HbA1c is greater than 6.5%, right? All right, so we have fasting blood glucose. I'm just gonna put BG, right? So you wanna make sure that you postpone administration of anti-diabetic medication until level is drawn, and tell them like it's fast, or you want to tell them to fast for the next 8 hours prior to the blood test. So you will tell them fast 8 hours prior to blood drawn. Right? Right? And then this can also last up to 12 weeks for the testing. Right? And then we also have here our oral glucose tolerance test. And it says it's often used to diagnose gestational diabetes. So we'll just say use to diagnose gestational diabetes. And the blood glucose levels are obtained every 30 minutes for 2 hours. It says here, the fasting blood glucose should be less than 110. So it should be from 70 to 110 mg per, I think that's deciliter or something. Okay. And then let's go on to our glycosylated hemoglobin. Also known as our HbA1c. And this is the most accurate, or it's the best indicator. of the average blood glucose level for the past 120 days. So that's what, that's 3 months. So 3 months. Okay. And then we can also check urine ketones as well. So put that here. Urine ketones and a lipid profile. And you get that every 1 to 2 years. All right. And honestly, there's more, but not really much of what I need to get into. So, yeah. Other than that, this is diabetes from ATI. I've been through it, going through it. So hopefully this helped. Alrighty, good night y'all, or hi.